Hi guys, so I wanted to go over my presentation with you today. My topic is patient education self-care programs. One second. Okay. So self-care patient education programs are programs that have consist of data on cardiac physiology and anatomy, risk factors for heart failure, diagnosis and symptoms, disease management, exercise and diet, medications along with their side effects, and blood pressure monitoring. So here's a little diagram of self-management and the external and internal factors that do come into play and affect this topic as well as a few educational programs components. So exercise bias, cognitive behavioral elements, multidisciplinary pulmonary rehabilitation programs, ongoing clinician and nurse support, as well as optimization of care plans. So here we have research evidence and a couple of factors that would make your evidence valid. If your evidence is valid, then in terms of self-care education programs, you have health impact, health disparity impact, as well as economic impact as well. So these are a few examples of research evidence. So there was a randomized clinical trial published by Doris in 2002, where a huge impact was found in effectiveness and cost effectiveness and an empowerment-based self-care education program on health outcomes in patients, particularly with heart failure. Self-care education programs also are, directly associated, linked to positive cardiovascular results, including lowered blood pressure, increased hypertension, related knowledge, and enhanced competence and understanding in hypertension of self-management behaviors. Self-care education programs also have been proven to increase medication adherence, self-efficacy, how you rate your health, cognitive symptom management, how often you go to the gym and exercise, especially aerobically, and depression through numerous researches. So, also economically, in terms of health models, but not actual costs, there's an actual estimate that health systems could possibly save $3.9 billion on a national level. This is if 5% of adults with one or more chronic conditions were educated, based on these programs. Also, from a racial standpoint, African American and white Americans have been positively affected by self-care education programs. This is based on different studies, but also more research would be needed as far as other races, other ethnic populations, and other income populations, particularly low-income populations as well. Examples in healthcare. So the Journal of American College of Surgeons, they did conduct their own study where they tried to transition people to self-care education programs, and then they used people that didn't have any education as their control group. Patient self-care education also and support has been applied to different communities and clinical settings. So this would be the YMCA, the federal qualified health centers, as well as managed healthcare systems. Patient self-care education programs also were introduced to women diagnosed with breast cancer related lymphedema by physical therapy specialists and physiotherapists. They wanted to reduce the risk factors of this disease and then apply self-care to patients after post-surgery. Clinical implementation. So these are three factors that have to do with self-care and affect self-care: self-management, how you manage yourself, self-testing, as well as self-awareness and being cognitive of your health education. So the health department agencies can refer patients to self-care, self-management programs. This is how they can implement it, provide resources. The CDC does have tool resources to help patients searching for self-care management education programs in specific communities. So one resource is called Learn More, Feel Better. They're trying to improve your health. Athletic training does have to do with these resources as well, according, as far as the CDC. According to NATA.org, athletic trainers should teach patients to implement self-care education daily. They should connect them with programs to help them, improve their education, which will improve patient outcomes, prevent injury and re-injury, as well as provide reinvestment for employers and employees, help benefit everyone economically. The goal for this clinic is to provide a source of health awareness so that the patient can understand everything as far as their health, make better decisions in order to prevent disease as well as handle disease that is already present. And that would be it. This is my bibliography and my cited sources.